apologies for that. So we genuinely did have an IT issue. This was also a bit of a joke at the start of the presentation to introduce our, myself and Catriona. We're here to present the preliminary results of the 4th National PALMSoc survey, which this year focused on the laboratory response to the HSE cyber attack. As Anne already mentioned, myself and Catriona are here. We're senior medical scientists in the clinical chemistry lab and also members of the Laboratory Medicine Innovation Hub under the guidance of Professor Bourne and Dr. Leonard. As everyone can remember, May the 14th this year, when news broke about the HSE IT systems having been hacked. Initially in clinical chemistry anyway here in Tallow, we thought we'd escaped the worst of it. All our systems were still in place on the day and everything ran relatively smoothly after the initial news broke. However, a few days later, it became a case that the cure was worse than the disease when some of the essential security IT checks that were implemented had a knock-on effect on our service for a few days. So having experienced that, we decided to focus on this topic for our survey this year. So we compiled an extensive list of questions to cover all laboratory processes to attempt to assess how the laboratories managed all their processes during the cyber attack. At this point, we would like to acknowledge the help we received from Dr. Rama Srinivasan, who's a survey lead from PALMSoc, who kindly helped us generate our questions into a concise survey. And we also like to thank Anne Kane from IEQAS, who also reviewed the survey for us. So as of the 13th of October, we've had 30 responses from 26 labs with a good geographical spread from around the country. We would like to thank everyone who has replied so far. And for anyone who has received the survey but hasn't completed it yet, just a gentle reminder to please fill it out. The graph on the left here shows that all laboratory disciplines were covered by the respondents so far in the survey. So thank you very much. I suppose we asked everyone what applications were affected in their hospital. Everyone is aware of the effect of the cyber attack on systems such as PIMS and NIMS. We just wanted to highlight here that 94% of labs at some point did not have access to any email, internal email within their hospital. And even more crucially, 26% had no access to a phone line at certain points during the cyber attack, which could have a big impact on the management of phoning clinical results. Again, everyone in the lab will know the significance of a laboratory information system in the management of samples from receipt to reporting of results. So we asked our respondents how many did not have access to lists during the cyber attack. 53% of our respondents so far have said that they had no access to lists for a period of time during the cyber attack. 13% of the respondents so far have said that they had no access to lists, to a functioning list for greater than 3 weeks. Of the labs who did already have a list contingency plan prior to the cyber attack, 93% said that they were able to implement it successfully, which was good news. So when you don't have a functioning list, what do you do next? So I'm going to hand over to Catriona, who's going to present the rest of the results.
Thank you. So as Caroline has mentioned, the majority of respondents so far didn't have access to a functioning list system. And as we all know, where do you go with that when the workload that we were seeing anyway, certainly in Tallow, was returning to pre-COVID levels? So huge numbers, huge sample numbers been receipted in. And how do you log these on your systems? Number one, never mind try and analyze that work without your interfaces. So we looked at the request management first, and this solely refers to the labs who didn't have a, a functioning system. So, 23% had working interfaces during this time, and 68% maintained a full service where there was no reduction in the repertoire of tests. Then when we looked at the workload, 22% of respondents saw greater than 50% decrease in workload. And the biggest reduction was seen from general practice. The ED and inpatient work was least affected, and there was no change to the minimum labelling criteria. And this was despite the fact that the majority of labs who responded, who would normally use medical record numbers or hospital numbers to register patients, didn't have access to hospital numbers. So it's a huge undertaking to register data without a list system. And then when we asked the respondents about the management of results, 74% introduced a second check on manually transcribed results, 23% did not have access to delta checks, range checks, or reporting rules. And this in itself, I get a cold sweat when I think about this because of the numbers reported, the numbers of samples to be reported, and certainly in clinical chemistry, the interpreting reports without your rules on a list system is just, I think is a mammoth task, and it's a credit to all scientists and all laboratories, I suppose, everyone in laboratories who managed to continually report and continually to provide a service to the hospital and obviously to some GP practices throughout this time. 71% of respondents use paper to record phone results. Again, going back to there was no changes made to critical phoning policies, so just huge manual tasks undertaken by staff. There was some labs when we asked how long they were without a list system, there were a number are affected kind of for more than a month and more than 2 months. So this was kind of quite a prolonged period for people to be using such manual systems. No change made to critical phoning list, as I mentioned. And when we asked them what was to happen to the data that the sample sent down or reported during this time, 65% of respondents have said that this will be retrospectively logged electronically, which again is another huge undertaking. So as well as, I suppose, the reporting of results and receiving samples in, everything else that happens in a lab, how did people manage? 47 of respondents placed additional staff on call. 93% of labs maintained the EQA processing. And when we asked how this was done, given that there wasn't internet access to that internally, the majority of respondents said that they accessed internet offsite, and some results were returned by phone where available, and some sites did have email available. So I think it just shows the commitment to quality across the lab service, and this was maintained under really trying circumstances. 50% of labs reported back that they had issues with stock, and interestingly, no site reported that this affected the service delivery, so there was no delay to tests or that. And certainly in terms of us, we had no access to the SAP system, which I'm sure was the same for many labs around the country. And the SAP helpline here and purchasing department really helped us in this regard, and we're just always on call and always on hand to help us with any issues we had. And interestingly, 96% of labs who responded maintained accreditation status. So again, just a huge undertaking. I think it shows, as kind of Ms. Nugent related to earlier, the adaptability of scientists and kind of always striving forward and striving to maintain the quality service that we do provide. Again, kind of this was in terms of the cyber attack and COVID, two kind of really big issues. So we asked at the end just about lessons learned, and these are some snapshots from the respondents. One, which was very relevant here, we could relate to. I work in point of care and helped out in biochemistry. We certainly had that from across the lab medicine department, people coming down to offer their time to help us when we had the issues that Caroline alluded to that really affected us, was the interfaces not working. The lab IT knowledge, I suppose again, a great communication with our IT department, and everyone who responded just alluded to how much they've learned about IT. Contingency plans never cover all contingencies, and again, how resilient medical scientists are. Just when we were looking at this, one thing we noticed was the real positivity. It was we didn't know about this, and now we're learning, and we have more contingencies in place. Again, just I think it shows that the labs are always moving forward and also always striving to put better procedures in place from events like this, and one, I suppose, which we hope we'll never see again. So that's the end of our survey so far, and just a reminder, the survey will close next Friday at 5 p.m. We're going to send out a second reminder this Monday coming for anyone that hasn't responded. A big thank you to everyone who has. We know it's taken time. We really appreciate the responses, and just gives an interesting snapshot of how labs across Ireland were affected by the cyber attack. Anyone wishing to have their lab added to the survey who hasn't had an email sent out yet, please just email palmsoc@tcd.ie, and we'll send out the survey to you on Monday. So thank you very much.